This is Dr. Jennifer M. Jones, prescribing psychologist, recording the progress note for patient Barnabas Bartholomew. Date 9/3/2021, session number 1, duration 1.5 hours. Follow-up appointment in several days on 9/7/2021. In the session, we discuss the following: limits of confidentiality and HIPAA, voluntary nature of evaluation and treatment, the risks and benefits to therapy, including medication management if necessary, compliance policy, service agreement, and fees. So the data regarding the patient's primary information: the patient is a 31-year-old Black male. The patient is married with 4 children ranging from the ages of 12 years old, 16, 18, and 24 years old. The patient was oriented to place and time, was dressed appropriately for the weather, and his clothes were ironed and neat. He was generally well kept. The patient denied having any suicidal or homicidal ideations. During the interview, the patient's right leg was constantly shaking and his palms were visibly sweaty. The patient had a slight stutter when he spoke, and patient is the oldest of 4 children, having 2 brothers and 1 sister. End of data. Assessment. The patient was referred to treatment by his primary care physician, Dr. Margaret Chell, who referred the patient for a mental health evaluation as a result of the patient experiencing extreme episodes of anxiety to the point where he is unable to perform his job duties as a truck driver. An Axis 3 patient questionnaire was conducted. The patient shared that the reason for his visit is that he is paralyzed when driving on a big patch of nothing. I feel, in quotes, on a big patch of nothing. I feel like I am not going to make it and then I can't drive. End quotes. The patient stated that this has been occurring for the last month. The patient also stated that he has difficulty thinking clearly at times. He says that he will lose track and have problems. The patient also stated that he has feelings of depression, and every time he thinks about getting on the road again. The patient also shared that when he is feeling extremely anxious, he has difficulty breathing. During the Axis 3 patient questionnaire interview, the patient was sexually suggestive in his responses to some of the questions. The patient was reminded that sex is never a part of treatment, and he was given the brochure discussing the details of what that means. The patient was asked to refrain from this line of responding. During the interview, the patient shared that he had difficulty in school, citing that the female teachers told him that he was not working to his highest potential, that he could do better, he was smarter. The patient indicated that the female teachers cared, but the male teachers did not seem to care. The patient denied any family history of mental or physical health issues. Patient stated that his sister is overweight and he believes that his mother may have some undiagnosed depression. Patient referred to his wife as a nag. The patient explained having trouble with his appendix as a child. He wears glasses for seeing in the distance, astigmatism. The patient states that he gets blurred vision when he is feeling high anxiety and cannot see clearly. It is like everything is a mirage. Patient smokes marijuana at least 2 grams a week starting at the age of 14 and denies any other substance use. End of assessment. Patient appears to have begun using marijuana in his youth to deal with persistent and untreated anxiety, which has exacerbated in his adulthood. The goal is to work with the patient to learn coping mechanisms to assist him in decreasing his anxious mood. Attending psychotherapy may aid the patient in getting an understanding of the root cause of his anxiety. Guided imagery will also be used to assist him with working through what triggers he may be experiencing at work when he gets to the open road and becomes immobilized with anxiety. The patient will participate in psychotherapy treatment 3 times a week for the next 3 weeks, with a 3rd week of implementation to see if what the patient has learned in psychotherapy has been effective in aiding him in decreasing his symptoms. If symptoms do not remit or decrease in intensity, a discussion will be had with prescribing the patient a starting dose of Xanax in planned and in note.